And today in parasitology, what we are going to talk about is an organism which is called as Toxoplasma Gondii. So, what is the importance of this thing is simply there is a condition called as toxoplasmosis. Okay, and toxoplasmosis basically cause a lot of you can say infections. A very important thing I would tell you about toxoplasmosis is that when you will study gynecology, especially, you are going to study a condition called as torch infections. So in those torch infections, T stand for toxoplasmosis, and simply uh, toxoplasmosis causes infection in those people. Toxoplasma gonadii causes infection in those people who are immunocompromised, and sometimes it affect the brain as well. Okay, especially in HIV patients or simply the patients who have compromised immune system or who are immunocompromised. And the second important thing is, as I told you, it can infect pregnant women, and it can lead to cause condition called as congenital toxoplasmosis in the child who are born to the mothers who are infected by this infection. So uh, now toxoplasmosis gonadii. First of all, the basic introduction. Okay, like introduction. Why we are like first of all, I told you the importance of this condition, and now I'm going to talk because we are studying parasitology, so I will be talking about this organism, right? So now it's basically a obligate intra cellular cellular organism, right? So obligate intracellular organism means what? Like simply it needs to enter inside the cell to causes infection, right? So and um, like obligate intracellular means like these organisms they need to enter inside the cell to grow, right? So of course, like it is, or you can completely say that it's a obligate intracellular parasite, right? Or parasite, okay, parasitic infection, organism, right? So now it is one cell. There is just one cell in this one, eukaryote, right? And I think like by now you must know what is eukaryotes and what are prokaryotes. So eukaryote organisms are those organisms like in which the nucleus is enclosed within membranes, right? And the prokaryotes are those like when there is in which like there is no membrane bound or like organelles are there. So this one is a eukaryote, right? So this one is eukaryote. So like talking more about this condition, like this thing, like these are basically unicellular, okay, um, okay, unicellular. So these are basically unicellular protozoa, okay, and they belong to like this Toxoplasma gondii. They belong to a family called as Coccidia. So uh, now this Toxoplasma gondii, it is present in three forms, okay, like three forms exist of this one. So what are those three forms are? Simply one is called as trophozoite, okay, sorry, trophozoite, and then one is called as tissue cyst, okay, and one is called as oocyst. So these three things forms are there of this one, right? So like now the important thing is about uh, like the tropozoites and the tissue cyst, right? Okay, these represent the asexual um, multiplication, while the oocyst they are what you can say formed by sexual reproduction. Okay, so again, like asexual reproduction and sexual reproduction, of course, like they are so basic concepts that I think everyone must know this thing. So you can see like this is the life cycle of Toxoplasma gondii, or as well as this is also the life cycle of Toxoplasma gondii. And this one more represent how it affect the humans, and you can see over here uh, wherever I is written, so it is the infective stage. This is the infective stage, and wherever D is written, diagnostic. So this is the diagnostic stage, or this is the diagnostic stage. So like this, right? So uh, of course, like as I told you that okay, and all these three forms which I told you here, okay, two of them they reproduce by asexual, and this one is reproduced by sexual. All these three forms they are present in domestic cats. Okay, domestic cats, and that's the reason that we ask the patient, the pregnant woman, to stay away from the cats. Okay, while they are pregnant, don't many of the many people, you know, they have the domestic cats in their home as their pets. So simply when they have pets in the home, so the important part is what that uh, they must not clean the cat litter, for example. They must not be in close contact with the cats, because they can contract this parasitic organism which is called as Toxoplasma Gondii. So all these three forms they are present in domestic cats, and also other things as well. But uh, this is an important thing clinically, you can say. Okay, so now uh, like the cats are the definitive host as well. Okay, and they support both what you can say schizogony or gametogony. So like if you know what is schizogony or gametogony, basically schizogony is when they reproduce by asexual reproduction, and gametogony means what when they reproduce by uh, sexual reproduction, right? So like these are the important points. So they all these forms uh, are present in domestic cat. Okay, domestic cat. So uh, and which are the definitive host. Okay, and it supports both schizogony as well as sorry, there is spelling mistake over here. Schizogony, and the other thing is gametogony. Okay, gametogony. So of course, like they support both of them. Okay, so now uh, the trophozoites. Okay, the trophozoites, which are the asexual form, and the tissue cyst, which is also the asexual form, they can also be present in other animals. Okay, including humans. So simply these two can present in humans. Okay, so and but like remember, like all these three things can be infectious to the men. Okay, so all these three things are infectious to men. Now like I'm going to what you can say, again we are discussing the characteristics still. Okay, so all these three forms you can say are infective or can cause infection or infectious to man. Okay, so that's the reason. Man means like of course like man and woman, right? So now the trophozoites are basically crescent shaped with one pointed end. Okay, uh, I'm not going to talk about their length and like how their nucleus look like. Uh, better to you can search it yourself, you know, because of course like that's written in all the parasitology books, and that's of course like is going to take a lot of time, not just yours and not just mine, but like yours as well, because uh, of course like they are not so important. But the important thing is uh, like because you know we have to concentrate on those things which are used more clinically. So basically the trophozoites, okay, here, sorry, the trophozoites, they stain well with um, Gimes stain, okay, and that's the reason, like, when we stain with them with this one, their nucleus, they and the cytoplasm, they give some characteristic color. The cytoplasm give blue color and the nucleus give red color. So uh, that's a very important type of staining, okay, which is used for the diagnosis as well, okay. So simply, like, whenever there is infection, of course, like, they keep on reproducing inside the human body, okay, and whenever there is infection, the trophozoites, they basically proliferate in the host cells and may appear round, okay, and that is called as a pseudocyst, okay. So that is called as a pseudocyst. So so they rapidly proliferate, okay, and whenever they infect the human, so they keep on releasing small trophozoites, or like the subform which is called as tachyzoids, okay. So they are called as tachyzoids. So what I'm saying, like, they keep on releasing tachyzoids, okay. So what are tachyzoids? Like, they are basically motile and quickly multiplying uh, trophozoites, okay. So simply, when they infect the humans, so they are highly motile, and they are and quickly, or rapidly multiplying, okay, in the, of course, human body, okay. So basically, these are those which are responsible to multiply inside the host, and basically they increase their numbers in the human body, okay. So simply, whenever any human, they consume a tissue cyst, uh, in like that is called as, like, the tissue cysts are called as bradyzoids, okay. So the tissue cysts are called as bradyzoids. Bradyzoids are basically slowly dividing, okay, stage, slowly dividing stage, okay. So of course, like, they are the one which is basically present in the tissue cyst, okay. So the tissue cysts contain bradyzoids, and once the person consume these bradyzoids, okay, what happens, like, the bradyzoids, they change first into the stage of sporozoites, and then the sporozoites, they make tachyzoids, okay. So one of the stages is also called as sporozoites, okay. So bradyzoids, they when the person consumes this, they change into sporozoites. So basically, sporozoites is a stage, simply, which can be characterized by when the parasite is in the oocyst. Parasite is in the oocyst, right? So this is important. So the bradyzoids, they change to sporozoites, and when the person have sporozoites, then the sporozoites are released. They infect epithelial cells, and they convert into a proliferating stage called as tachyzoids. Okay, so tachyzoids, they are motile and they are quickly multiplying, and they are the one which keep on increasing their population inside the human body. And what happens, like, these tachyzoids, like, simply, they can spread all over the body, okay, in the blood, of course, through the blood, okay, through the blood, they can spread to all over the body, or to um, different parts of the body through the blood, right? Like, remember, like, if something is in the blood, so it can disseminate anywhere, right? So what happens, uh, like, during the latent, or like later on, when there is a chronic stage of this infection, the tachyzoids like stage convert to bradyzoids, okay, bradyzoids, to form the tissue cyst, okay. Now there is one more thing called as merozoites. So what is merozoites? Like, simply, merozoites also divide quickly, okay. Merozoites also divide quickly, and they are responsible for expanding the population uh, in the cat's intestine before sexual reproduction. Okay, so this is like about merozoite, and what happens simply like the merozoites, they can be released and as bradyzoites in the form of tissue cyst, and then again the stage is started. So you can see like over here, um, this is the enteric cycle, okay, and this one is the exoenteric cycle. So, uh, like if you'll see over here, um, okay, here they are naming it a little different, right? But the things are same. So the ooze is formed and excreted in feces, and they are present in the soils, and they are present as sporulated oocyte. That is the infective stage, and this contaminated soil is the, containing this thing is ingested by the rats or birds, and they will form tissue cells formed in the birds or rats. Cats acquire the infection, okay, by ingestion of the meat of these things, and then there in their intestines, what happens, like there is bradyzoids, okay, which I was telling you, and these bradyzoids are slowly dividing parasites, okay, that will make a tissue cyst, right? And what will happen that when the in the from their intestine, when these bradyzoids are going to release, okay, of course, like from their intestine, like they will release them in their feces. So what will happen, like see these bradyzoids are released, and they undergo schizogony, asexual cycle in mucosal cells, okay, and many merozoites are formed, okay. So when this merozoites are formed, see what happens, like they are keep on increasing. So again, like the humans can also ingest this one. See, man acquires infection by ingestion of contaminated food, which are having this thing, okay. And then what happened, like again in the small intestine, the same thing, sporozoites or bradyzoites and sporozoites, and infect intestinal mucosa and spread to other organs like brain, liver, and muscles, okay. So this is the cycle which is going on. Again, like you can see the cycle over here. A very simple way to tell you, like this is a definitive host, this is the intermediate host. So the oocytes which are taken by these, okay, and the cat consume the meat of rat, and they take this thing, and then after 2 weeks the cat keep on shedding this oocyst, and okay, this oocyst can be taken by humans or by the other what you can say mammals, okay, like pig, sheep, or cow, right? So like of course, like the man mostly, like they don't spread this infection, okay, like that is a dead end you can see over here. And again, this one is the same thing, telling you the same story, okay. So simply see, the person can contract it from the soil, or the person can contract it, of course, like because they are released in the cat feces. So we can have this thing. So like of course, like I try to explain you these things in a very quick way, but that's what is going on, like what is tachyzoids, what is merozoites, what is bradyzoids, and what are sporozoites, right? So tissue cyst, simply uh, like uh, like these tissue cyst, which is this form, right? Tissue cyst. Uh, if I will talk about that one, they are formed during the chronic stage of the infection, and can be found in brain, which is the most common site. Okay, and that's why I was talking about this thing, and also in the muscles and other organs, it can be present. So now, basically, what's inside these tissue cysts is basically bradyzoids, okay. So which is like a slowly dividing stage, okay, you can say. So these what you can say, this tissue cyst can be present, especially in brain, so that's a very important thing, okay. And uh, oocyst, of course, they just appear in this one, okay, like this one, definitive host, and they are present in the intestine of the cats, okay. So now the oocysts are formed by sexual reproduction, or you can say gametogony, right? So see that's why it is written over here, gametogamy, right? So they are only produced by the sexual reproduction. So the cats, they basically shed millions of oocysts per day in feces for about 2 weeks during the primary infection. And what happens is, the freshly passed uh, oocyst is not infectious. Like, of course, in the soil, these, like, if someone is going to take these things, they will not get any infection. But in the soil, what happens, like, there is the formation of, like, see this one, the cat is shedding this one, okay, the oocyst, but basically they are not infectious. But the oocyst basically undergo gametology, and see what they are forming. They are forming a sporulated oocyst. Okay, so this sporulation occurs in the soil. Okay, this sporulation occur in the soil with formation of two sporocysts. Okay, and this one is an infective form, and when this one is taken by to the humans, of course, like, it is going to cause infection in them. So simply, that's why you can see that the Toxoplasma Gondii life cycle uh, is like in having two hosts. Okay, so the definitive host is like the cats and other animals, and in this one, like, both sexual and asexual reproduction is going on. Whereas the intermediate host is the man and other mammals. If you will see over here, man or other mammals, or this one, man or other mammals. Okay, of course, like in this one, only asexual reproduction you can see is taking place. Okay, only asexual reproduction is there. Okay, so this two life cycles are also called, as I told you, enteric cycle as well as exoenteric cycle. So simply, because this one, why this is called as enteric cycle, because this one is going on inside the intestine, so that's why this is called as enteric cycle. And this one, of course, like, it is taking place other than enteric area, so that's why it is called as exoenteric cycle. So enteric cycle is also called as feline cycle. Okay, so uh, now in this one, what are the differences? In this one, both sexual gametogony as well as asexual, okay, or you can say schizogony are taking place. Okay, so both gametogony as well as schizogony are taking place. Okay, and where it is taking place? In the mucosal cells of the intestine of the cat. Okay, so how the cat acquires the infection? When the cat take it from, what cat get its food from, the rats or the birds. Okay, so simply, uh, the cat take it from here. Okay, and the bradyzoids uh, are released in small intestine, and they undergo asexual multiplication, schizogony. Okay, leading to formation of merozytes. So this thing is important, guys. So if you understand this thing, then there will be sporulation. This process is called as sporulation. Okay, so basically, there is a formation of a macrogamete, which is uh, what you can say. There is a formation of a macrogamete. Okay, and it will form a microgamete. Okay, and what will happen, like, it will result into formation of oocyst. Okay, these oocyst formation. So see, this macrogamete will fertilize with the microgamete, and these fertilization will result into the formation of oocyst, right? So this is called as sporulation. Okay, yeah. So in the soil, when this is the infective stage. Okay, and in the human, now, uh, in the humans or in the sheep or in the cattle or pigs, whenever, like the people, they eat uncooked meat or in undercooked food, especially lamb or pork, which have this tissue cyst. Okay, and by the way, this mature oocyst can also be taken through food, water, or contaminated fingers with cat feces, directly or indirectly. Directly means, like, if you have a cat and you are dealing with the feces, and indirectly simply means when you don't have a cat, rather the cat uh, lay down feces in the soil, and, like, maybe because many of the times, we come in contact with soil, and if we will not wash hands, and take that. So of course, like, they can get. And one of the way of infection to the humans is by uh, congenital toxoplasmosis, like in which like the mother have and she pass it to the baby. Okay, so this thing is important. So again, like I already explained you the stages in the man. So the sporozoites from the oocyst, okay, they will form bradyzoids. Okay, so bradyzoids will be released from the tissue cyst, and they will multiply asexually. They will form tachyzoids. So these tachyzoids are formed. So now the stachyzoids continue to multiply and spread locally to the blood as well as the lymphatic system. Okay, and now remember, when they enter the blood, they can go anywhere. Okay, they can go anywhere. So like we don't have to talk about, like, of course they can go to the brain, they can go to the liver, they can go to the muscle, they can go to the eye, they can go to spleen, they can go anywhere. Okay, and what they will form a tissue cyst. So the slowly multiplying forms inside the tissue cyst are also called as what? Bradyzoids. Okay, which I show you over here. Bradyzoids. Okay, so of course, like the bradyzoids will be formed. Now, so uh, what you can say, once like it is infected, the human, of course, like it is a dead end of this infection, because the infection, the humans, of course, like they are not eaten by anyone, so that's why like it is called as a dead end. Okay, so uh, like that end of this infection. So see, like you can see, like it is not continuing anymore. So now when we have discussed this thing, so of course, like the main point was to make you understand this cycle. Okay, enteric as well as exoenteric cycle, and tell you the characteristic or different stages. But also you can say, um, talking about uh, different type of conditions which this thing can form. So what clinical, what you can say, um, clinical presentation of this infection can lead to. Okay, and of course, like when we are discussing about this thing, so we will just talk about what it can cause in human. Okay, because there are many parasites which causes infection in other things, not in humans, so we don't care about them. As I told you guys, it causes infection in immunocompromised people. Okay, and who are immunocompromised people? The people who have HIV/AIDS, the people who have cancers, the people who are too young or too old, the people who are using some drugs like called as steroids or immunosuppressants, the people who are having chemotherapy or radiotherapy going on. Their immunity is not good. We call it as immunocompromised people. Okay, and uh, like when the persons uh, they they can cause they contract this infection, toxoplasmosis, and their immunity is good, so they remain asymptomatic. Okay, they remain asymptomatic. So and also like when the females they get infected by this during pregnancy, uh, they can cause congenital toxoplasmosis to to their newborn. Okay, plasmosis. So congenital toxoplasmosis to their newborn. So of course, like I don't want to show you right now what are the features of congenital, like how the baby looks like, because you will again study this thing in gynecology, uh, in obs, by the way. So what happened, like the females when they are pregnant, and they get this infection, what happens, like this toxoplasma or toxoplasma gondii, it can pass from the mother to the baby through the placenta. We call it as vertical transmission. Okay, so vertical transmission is what? Vertical transmission is when the infection pass from the mother to the baby through placenta. Okay, so simply when the mothers, they get infected with toxoplasma or toxoplasma gondii, uh, and if their baby, uh, they will show the features of uh, toxoplasmosis infection, because not all the babies, they are born abnormal, but like uh, what you can say, few of them who show the features, we call them as having congenital toxoplasmosis. Okay, so which can be anything like fever, jaundice, rashes. Their eyes are small, called as microophthalmia. They may have cataracts. Okay, they may have cardiac abnormalities, and one very important thing, they have cerebral calcifications. Okay, so I can write down few of the features just to tell you guys. Fever, they can present with fever, rashes, microophthalmia, as well as uh, they can have cerebral uh, calcifications. Okay, and cardiac defects, as well as choreo retinitis. Okay, so chorioretinitis, all these features are the features of congenital toxoplasmosis, and whenever like someone immunocompromised people, they got this thing, we call it as acquired toxoplasmosis. Okay, so congenital, like when you have something from birth, and acquired is when you are getting it later on, right? So now whenever like someone have acquired congenital acquired toxoplasmosis. Okay, so um, acquired toxoplasmosis. Okay, what happens is, if the person immunity is good, okay, they remain asymptomatic. But if the person immunity is not good, then they, or immunocompromised people, they may have all the other things. Okay, they may have any inflammation or infection of any part of the body, like myocarditis, meningoencephalitis, things like this. Okay, and it can also causes ocular, or uh, ocular, like the eyes are affected. Okay, toxoplasmosis. So and whenever like it is in the immunocompromised people, it basically affect the central nervous system the most. Okay, so uh, in immunocompromised people, you can say, you know remember it, most commonly it involves the brain. Okay, so that's a very important thing. And in AIDS patients, like whenever we do CT scan and we found a ring enhancing lesion in them on CT scan, it's a very good sign that the person have what you can say, toxoplasmosis infection. So, talking about the lab diagnosis of these patients, okay, how we diagnose them on the labs. So you can see like the lab diagnosis can be done by microscopy, serological uh, investigations, molecular investigations, imagings, and others, right? So microscopy is simply what they are going to do. Like they will take the specimen of the blood, they will take the specimen of the sputum, they will take a specimen of CSF, for example, and they are going to see it under the microscope. Okay, so I told you about the staining. Okay, the staining is used to look at them, and they, like I told you, like they appear like a crescent shape with pointed end. Okay, so simply like they like on microscopy they can catch easily these patients. Okay, and when it's come to the serological type of investigation, so antibody detection can be done. Now I don't know like how much pathology you have covered or immunology you have covered. uh, Whenever like we have any infection, the microorganism, it brings antigen, so we can detect that antigen in the blood, and our immunity make antibody, so we can detect antibody as well. So antibody detection can be done by checking IgG antibody. We can do ELISA, We can do indirect fluorescent antibody testing as well. Okay, so all these investigations can be done. Okay, to uh, check this infection. So this thing can be done, as well as we can check IgM antibody. IgM antibody are those which are formed like simply acutely, and when someone have a previous infection, so IgGs will be raised. Okay, so we can do this one test. Okay, so antibody IgM can be checked. Okay, as well as we can also do tests for IgA antibody, and we can also detect antibodies by ELISA. Okay, so all these things can be can be done as well. And when it comes to the molecular diagnosis, guys, PCR is the best one. Okay, so simply what is like PCR is polymerase chain reaction. So like this one is the best test. Like we can simply take any body fluid and we can or the blood and we can conduct a PCR to catch this thing. When it's come to the imaging, of course, like MRI or CT scan can be done for central nervous system involvement, and as I told you, ultrasonography is good for congenital toxoplasmosis treatment, right? And other tests like leaves these things because like they are not practiced much. By the way, nowadays, of course, like just one or two tests are needed. Of course, we don't go for like. Of course, we are discussing a lot of choices over here, but in reality, we just go for one or two testings which are have good sensitivity and specificity. So we go for that and done. Like we can make the diagnosis. And how we treat or what is the treatment of these patients? Uh, of course, like whenever like depends like either it's a congenital infection. Okay, either it is a acquired infection. Okay, and infection. Okay, so remember, wait. Okay, either it's acquired infection, and if it's acquired infection, either it's a infection in immuno competent. Okay, competent immunocompetent means like the one whose immunity is good, or immuno compromised. Okay, so depending on like either the infection is in the immunocompetent or immunocompromised, the treatment depends on that thing. So when it comes to that congenital infection, there is a drug called as pyrimethamine. Pyrimethamine. Okay, pyrimethamine can be used, and sulfadiazine can also be used. Okay, and sulfadiazine. So sulfadiazine can also be used. Okay, in these patients, and whenever it is like immunocompetent person, the one whose immunity is good, so then like what we can use is like they are asymptomatic, and most of them they don't require any treatment, but the patient who have especially ocular uh, toxoplasmosis, we can do give them the same drugs like um, pyrimethamine and sulfadiazine. Okay, so we can give them same drug, but whenever like it comes to the immunocompromised people, so here of course like we take it serious because it can cause serious CNS involvement in the patient who have especially immunocompromised or the patient who have AIDS. Okay, so for this one, try methoprim, sulfamethoxazole. This is the short form. Okay, try methoprim sulfamethoxazole is a drug of the choice. Okay, so we give them this drugs, trimethoprim sulfamethoxazole. If there is some people who have allergy to the sulfa drugs, they cannot take this thing, then we can give them dapsone with what you can say pyrimethamine. Okay, like for those people we can give um, this drug. Okay, so remember guys, like whenever the patient have AIDS, okay, we give them antiretroviral drugs to keep their cell count, CD4 count cell more than like in normal range, so that they don't have this thing. So remember, whenever we discuss any infectious diseases, so we always know we have to study how to prevent these conditions. So how we can prevent this condition? Things are easy. Especially, hand hygiene is important. Like, what is hand hygiene? Like, keep on washing your hands, okay? Especially when you are coming from outside. Pregnant women should be careful uh, when handling what you can say, cats feces, for example, okay? Cooked food, and when we say cooked food, basically what we mean to say is properly cooked food. And uh, wash all the raw vegetables or fruits, okay, before eating, of course. That's important. Drink water from safe sources, like safe sources, any safe source, or drink like boiled water. So all these things, of course, can be done to what you can say, prevent this infection, okay, from spreading. Okay, so um, I think like that's all for this toxoplasmosis. Okay, uh, I don't think so. Like any point is left in this one. So see you guys in the next lecture. Okay, thank you for listening. I will see you around.